it doesn't, I can't use it. So let me read the definition. Nausea, the state in which an individual experiences an unpleasant wave-like sensation in the abdomen of the throat, epigastrium, and throughout the abdomen that may or may not lead to vomiting. This is what's going on with the patient. So she definitely in the nursing diagnosis book, it will have what's called defining characteristics. And there's major and minor. And there has to be at least one or more major characteristics of this patient presenting with in order to use this diagnosis. So let's see what it says. It says usually precedes vomiting. Patients had that. It's accompanied by pallor, cold, and skin. Patient has that. May have tachycardia. She has that. And reports nausea. So there we go. We can use this diagnosis. Now, if she wasn't having these things, we couldn't use the diagnosis. You would have to find something else. So what we're going to do is we're going to put nausea because we've met that. Now we have to look at the related to part. The related to part also comes from your nursing diagnosis book. You copy it verbatim what the book says with what criteria it is. So in your book, it'll say related factors. Related factors is the related to part of why is this patient having nausea? What's it related to? What's causing it? And in the book, the reason that this patient's having nausea is related to effective chemotherapy. The book says that verbatim. So let's look at another scenario. Say that this patient came in with a GI bug. A related to part, according to the book, instead of being related to chemotherapy effect, would be related to gastrointestinal irritation secondary to acute gastroenteritis. So the related to part comes from the book, and the diagnosis part comes from the book. Now let's move on to our third part, which is the as evidence part. The as evidence part is evidence that the patient is presenting with why you're using this diagnosis. So, as evidence by patient reporting nausea and chemotherapy, because over in the subjection and objective data, this is where the patient is saying she was nauseous and having chemotherapy treatment. So that's your as evidence by. So let's read the whole nursing diagnosis and show you what it is. Nausea related to the effects of chemotherapy as evidenced by the patient reporting nausea and chemotherapy. So that's your nursing diagnosis. Now once you develop that, we're going to move on to your next step, the planning part. The planning part is patient goals. A couple things you need to know about planning. Planning needs to be specific to that patient, okay? Meaning that what's going on with this patient is nausea. So our goals need to have goals to correct that nausea. Second, they must be measurable. Whenever you read them, your professor or another nurse must be able to look at it and say, okay, how are we going to know we met this goal? How do we know? So let's start it. Okay, first goal I want to have for this patient. Whenever you're developing your patient goals and you're first starting out, I really recommend that you use your nursing medical surgical book or a pathophysiology book or another type of nursing book to help you with these interventions. Because whenever you're first starting out, like I've said, you might not know some interventions to do for this patient because it's new to you. And looking through these books and reading the text will help you start thinking like a nurse and developing. And this is what you're developing all by yourself, and it's going to help meet your diagnosis. So what I developed for mine, the patient will report decreased nausea within 6 hours. We want her nausea to be gone within 6 hours. So that's the goal. It's specific to the patient, and it's measurable within 6 hours. Next, I put the patient will tolerate clear liquids within 12 hours without nausea and vomiting. It's patient-specific. It says in 12 hours she'll be able to have clear liquids for nausea without having nausea and vomiting. That, to your professor or another nurse will say, hey, we can do this goal. That means that the patient's nausea is getting better. Typically, when a patient can start consuming something without the nausea and vomiting, it means that we've got somewhere in the nausea is subsiding. The next goal, the patient will verbalize 5 foods and liquids to avoid that makes the nausea worse. Typically, with patients who are getting chemotherapy, they become really sensitive to foods that normally wouldn't affect the patient who's not getting chemotherapy. So they start having food intolerances with that. And the only reason you would know that as a nursing student, or unless you've been through that, is when you read through your text. start understanding how chemotherapy affects patients. So that's a really good goal for chemotherapy patients who've been having nausea and vomiting that may be being caused by a stimuli like smell or certain food. So that's one goal. Now, since we're done with that, we are going to develop our intervention. Our interventions are called nursing interventions. This is what we're going to do with the nurse so the patient can meet their goal. Okay, so the first intervention we're going to do, again, there's two things you need to know about your interventions. They have to be specific to the nurse, meaning the nurse is going to do them, and they have to be measurable to prove and to show how you're going to do this. So whenever another oncoming shift comes on, they can follow it exactly how it was written. So, first one is the nurse will administer Zofran 4 milligrams IV every 6 hours per MD order as needed for nausea and vomiting. This right here will help our goal that we set for the patient to decrease their nausea, Zofran. Next goal, the nurse will assess patient's nausea every 2 to 3 hours. This is very important because you have to know how the patient is having nausea, and you have to write it down to see how many times you need to do it so you can prove that you're assessing the patient's nausea. So that's another important goal. If you can never think of a nursing intervention, always try to do a nursing intervention that is assessing for something so many hours. That's always a good one, and you're always safe with that. Next, the nurse will provide the patient with clear liquids when nausea is under control within 6 hours. That intervention is proving that you are going to be offering the patient clear liquids every hour or every 2 to 3 hours and giving them and assessing how it's affecting them. So that shows that you are meeting that goal. Next, the nurse will educate the patient on 5 foods and liquids to avoid for nausea. This will go back to your last patient goal that you set, and this will show that as the nurse, you're setting with the patient, you're trying to educate them on 5 foods or liquids that is aggravating their nausea and making it worse. And then you're going to have the patient verbalize back 5 foods and liquids that's affecting them so that you know that the patient understands how to avoid those foods. Now, so that's your nursing interventions. Now, you may be wondering, how many nursing interventions are you supposed to have? How many patient goals are you supposed to have? It really depends on what's going on with your patient and what your professor wants. I would typically do 4 or 3 or however many you want just to know that you've met your case of meeting your diagnosis. If you don't know, always ask your professor. They'll be able to help you, but typically that's pretty safe. Now, our last thing is evaluation. The evaluation, typically on a care plan, you'll have met or unmet, and you'll circle if the patient has met that goal, because that's what we're talking about, or has unmet it. Now, patient's met it, that's great. You're saying that the patient will report that nausea will be decreased within 6 hours, so that's great. If they don't meet it, what needs to be done is either you're going to need to change your nursing diagnosis because maybe something else is going on with the patient, or you need to change your goal for them, or you need to add some more interventions so they can meet that goal. That's all evaluation is doing. If on the job, you'll notice that a care plan will have, if you're a lot of people, if they have paper charting, you'll know that the care plan will have marked out or things will be changed because it's always changing because patients are always having new problems, especially when they're in the hospital and they've been hospitalized for a long time. The care plan just helps us stay on track and making sure that we're targeting that patient's specific needs of what they need. Now, also, I want to mention this because this might be on your nursing care plan, is you might have to have a rationales column. The rationale column is really for you to start thinking as a nurse and making your professor understand that you understand why you're doing these interventions. Because typically that's where the rationales go. You'll say why you're doing this. So, for instance, the nurse will administer Zofran 4 milligrams every 6 hours as needed for nausea and vomiting. And then you would have to put a rationale beside of it. And the rationale you would talk about Zofran and how it works on the body in decreasing nausea. It attaches to those receptors in the gut or in the brain, and it decreases nausea. And that would come from your drug book in that you're explaining to your teacher, you know how Zofran works and you know how it treats nausea. So typically there will be a rationales column of why you have to do that. So that is how you do a basic nursing care plan. So on our website, registerednursern.com, we have some care plans for educational use that you can use and help you in developing your care plan. It can give you some ideas on some nursing goals you can use, or nursing interventions or patient goals you can use. So I hope this help clarify some things. And thank you so much for watching. And please subscribe to our YouTube channel for some more teaching videos. And thank you so much and have a great day. Hey everyone, this is Sarah with RegisteredNurseRN.com, and today we're going to go over nursing.
Okay, so what I want to do
Max,
next
what are
is
you
just
doing?
a real quick review of what she said and how do you prepare for Wednesday. And then I'm going to go to the roll. You're going to tell me 8:30 or 11:30. So I'm going to go back to our Blackboard. And I'm going to scroll down to week 9 for our activities and assignments. Let me drop that down. And we're looking for week 9. Okay, so here's 9. And you have a to-do list. So for nursing care plan, if you looked at your syllabus, there are a lot of chapters. But even if you read all of the chapters, I'm not quite sure that you could practically apply the information to come up with a good care plan. So what I really have expected or will expect by Wednesday is that you have looked at chapters 4, 5, and 7 and done Cornell notes on them. Hopefully you did that this weekend. So remember, as soon as you finish your test, you should start doing Cornell notes on the knowledge answers for the next test. So the main chapters for the next test will be 4, 5, and 7. And then there's some information on communication and Maslow that I will give you handouts from. A lot of these links that I put here are forms that are required to do care plans. I will bring the forms on Wednesday. So if you open each one of the links, if it's a form, don't worry about it. If it's information, you need to read it. So again, the first of these are forms. Here's the form for the nursing care plan homework once you go to clinical. Here's the list of the nursing diagnoses that you can use when you're making your care plan. Here's a goals exercise. This is how you do the care plan, kind of simplified. It's sort of like my cheat sheet. And then here are some questions to ask. So the first few things, about 8 things, are things you don't really have to worry about because I'm going to bring them on Wednesday. When you go down a little bit further, and I will email you a list of all of your PowerPoints. I want you to, again, do Cornell notes on those chapters, but more importantly, for Wednesday, I want you to have attended Mrs. Jackson's tutoring on nursing care plans. And then I'm going to give you a list of terms that I want you to do Cornell notes on. So the list of terms are the steps of the nursing care plan process. So go ahead and pull out a piece of paper and a pen, and I'm going to give you the words. If you haven't already done Cornell notes on the chapters, kind of put those aside for a while